Good morning, all. I'm Dr. Nagraj from IIP Digital Media team. I'll be host for today's webinar on sports injuries prevention and management with resource person Dr. Anand Ganwal, being organized by IIP Women's Cell, West Mumbai District, Maharashtra State. The Indian Association of Physiotherapists is the oldest and largest association representing physiotherapists in India since 1955. The IAP digital media team consists of a group of physios who handle Zoom platform, webinar, live streaming, and IAP profiles on social media platforms like Facebook, Instagram, Twitter, LinkedIn, and YouTube. Follow IAP profiles on these social media to receive notifications for our events such as webinars, workshops, CMEs, conferences, health camps, blood donation drive, and to know about recent updates on physiotherapy. Subscribe to IAP YouTube channel for notifications to our live webinars in playlist section of this channel. Webinars are segregated into various folders on topics like orthopedics, neurology, sports and fitness, pediatrics, cardiopulmonary, women health, and research, cancer rehab, etc. For easy access, the social media links will be shared in chat shortly. So, without much wasting your precious time, I would like to hand over this session to Dr. Urve ma'am. Over to you, ma'am.
Thank you, Dr. Nagraj. I'll just introduce our speaker of the day, Dr. Anand Gangwal. Sir, Dr. Anand Gangwal is a consultant sports and musculoskeletal physiotherapist. He has done his master's in orthopedic sports and manual therapy from University of South Australia, Adelaide. He has also done advanced training in post arthroscopic rehabilitation and sports injuries from ISA KOS approved training center, Barcelona, Spain. Presently, he is the director of Prime Physio Clinic in Pune, which is a specialty sports and musculoskeletal physiotherapy clinic. Dr. Anand Gangwal is an associate professor at Sancheti College of Physiotherapy and first postgraduate sports physiotherapy guide under Maharashtra University of Health Sciences. He has worked as a sports physiotherapist for elite Indian athletes from various sports. Dr. Anand Gangwal has been consistently working at grassroots level and with national organizations to bring to light the importance of a sports physiotherapy and injury prevention. Dr. Anand Gangwal is a recreational sportsman himself, having completed the Ironman in Austria, multiple half Ironmans, and marathons. Sir, we welcome you to the webinar. You can start with your.
Thank you, ma'am. Firstly, I'd like to thank the IIP Women's Cell for inviting me for this webinar. I will not waste a lot of time and just move on to our presentation today. Um, Before we start, I'm now to give you a brief more background that I'm more a clinical therapist in a clinical setting. First 3-4 years from 2007 onwards up to 2010, I did travel with a lot of athletes and worked as a physio. Then eventually went on to set up my own clinic in Pune. So today's topic is sports injuries, prevention and management. Uh, Yeah. So as everybody knows, it's all about teamwork. Like any sports team, even the sports medicine team, there are a lot of people who contribute to the athlete, and right from a sports physician, a orthopedic surgeon, a radiologist, a podiatrist, exercise physiologist, a psychologist, um, massage therapist, nutritionist, strength and conditioning coach or a trainer, a biomechanist. So it's all a team approach in this. And down below, if you see, I'm written coach. So coach is again a pivotal person whom all these people need to coordinate with. And definitely we should not forget the athlete, because in the end we are doing all this for the performance and well-being of the athlete. So, what is the role of a sports physiotherapist? Sports physiotherapist, as we go on in the presentation, I will be talking about a lot of roles of a sports physiotherapist, but primarily injury prevention, managing and treating injuries, then uh, following on after an injury, proper rehabilitation, recovery, return to sport, and injury prevention. So, all these are linked to each other. And as we go on, we will see further roles of a sports physiotherapist and how to manage sports injuries. So, like this webinar, there are a lot of ways to teach, learn about all these things. For example, this webinar, other than that, we have books, classroom teaching, journals, workshops, a lot of workshops happening, and the internet as well. But as a sports physiotherapist, a lot of practical application is required and knowledge about the sport is required. So I would encourage people who want to work in the field of sports to themselves understand the sport and also understand fitness. And I personally feel as a sports physiotherapist myself that you yourself need to exercise on a regular basis. Yourself sometimes need to undergo few injuries to understand the psychology behind it and loss of participation due to the injury. And I personally have experienced this a lot of times. If you're working with a specific sport, you need to know the nature of the sport. Is a contact sport, it's a non-contact sport, it's an endurance sport, it's a strength sport. You need to understand the nature, this nature, and what kind of a common injuries, basic biomechanics, and what is the age participation, because your line of management changes. For a sport like gymnastics, you'll see a lot of or swimming, the kids are at a much a smaller age, whereas in endurance sport, they might be performing till later ages as well. Apart from this, you should be certified in CPR, lifting, transporting if on field any injury occurs, because that is also quite crucial. Along with that, to become a good sports physiotherapist, excellent assessment skills, because many times you are the only one when the injury occurs present there. And you sometimes have to make a decision in few seconds or less than a minute if this person is going to be able to continue to play or not. So that is extremely crucial to keep in mind. So quick assessment skills, then good manual hands-on techniques such as taping if you want to immediately get that athlete back on the ground. Um, then excellent communication skills, because physiotherapists can be really again play a pivotal role to communicate between the surgeon, the doctor, the trainer, the coach. So a physiotherapist can really play an important role, and the time spent by an athlete who is a physiotherapist um, is much longer in the treatment. So many times the athlete will open out to you when you're treating, you're doing some manual technique, or you've given some electrotherapy, and then the athlete starts talking with you. And that is the time to understand how this injury is affecting that person. And especially at elite level, all these things very properly need to be communicated to the manager, the coach, so that team selection and all these things play a very big role at elite level. So that's why communication skills need to be excellent. There has to be a good treatment planning, because an athlete is first question an athlete is going to ask you is when can I return back? And that sometimes can get very tricky. Uh, for a injury like an ACL or an ACL reconstruction, we know that 8 to 9 months, depending on the nature of the sport, or sometimes 6 to 7 months, the athlete can return to sport. But with other injuries, there are no set perfect timelines. But giving a rough idea to the athlete, it all depends on your knowledge about their injury and about also the athlete, so that you can give proper timelines. Apart from that, traveling with a team, there are a lot of things. We can have a entire webinar on traveling with a team. Due to time restraints, I'm not going to go to that, but simple things. If you're going abroad, are there any vaccinations needed? What are the hospitals close by? What are the medical services, emergency medical services, which will be available when your team travels to that location? There are a lot of things apart from that, and you might sometimes have to do acute management where you might on phone need to consult the doctor back home if your athlete needs any medication, and with the help of the doctor or the orthopedic surgeon, you might have to get that done as well. Apart from that, injury prevention is a continuous process which we'll talk about later. So basically, there are two types of injuries. There are acute and overuse injuries. Acute injuries are basically due to contact, direct blow, and they further can be classified depending on the area of the injury. So bone, ligament, tendon, nerve. Whereas overuse injuries can get a bit tricky, where uh, there are multiple contributing factors to overuse injuries. We'll see that in the next slide, what can be the contributing factors. But what I've highlighted: repetitive overload, incorrect technique, incorrect equipment, and many times with overuse injuries, you might have an athlete continue to play. Yes, ma'am, Urvi ma'am. Anything? Sorry.
No, sir, you can cut.
So the athlete might continue playing with the overuse injuries. So that is again becomes a bit tricky because the injuries, initially overuse injuries, are not very painful. So you have to take that call where you are going to allow that athlete to continue playing or not. So again, these are certain things about overuse injuries, the terrible twos: too much, too soon, too fast, too hard, too often, and too little rest. So we'll cover these factors as we go on. Coming to contributing factors to injuries, there can be intrinsic and extrinsic factors. Age, okay, of the athlete, that will affect the healing. The age, younger athletes will recover faster, older athletes might take time. Whereas in younger athletes, those injuries might be related to growth spurts, whereas older athletes, and you are seeing a large number of older people participating in sport these days, that might be more degeneration as well. Joint stability or instability, lack of strength. Strength training is not given so much importance, so that needs to be emphasized. And you need a good trainer or a strength and conditioning coach working along with you, because as a physiotherapist, we can't do everything. And the science of strength and conditioning has evolved. It has become more complex. So always work with a strength conditioning coach, and to get the athlete back to the level, or to prevent injury as well. Foot control, body coordination, foot alignment again plays an important role. So good foot assessment, and that can help to prevent injuries. The level of fitness, previous injuries, the rehab done after previous injuries. So many times uh, uh, athletes with ankle injuries end up with ACL injuries because they did not do the ankle rehab properly, and then they strained their knee. So previous rehab also makes important factor, and emotional stress, emotional anxiety. There is a lot of these things. I have seen it in top athletes performing at top levels. So psychologist also has become very important, a sports psychologist, in helping you out to deal with the athlete. Other intrinsic factors: the intensity of training, sudden increase in training intensity, playing surface. So again, one more thing which I commonly see in sports like tennis or athletics, where they are practicing on the ground which doesn't have a synthetic track, for example, athletics, and then they go and perform on a synthetic track, or they don't get an access to a synthetic track on a regular basis. This can cause some issues and some overuse injuries. So there should be gradual exposure to the surface, and ideally that athlete should, even in sports like kabaddi, wrestling, where they might be practicing on, for wrestling, they might be practicing on mat and the competition on mud, and then they go and play their sport competition on a mat. That also makes a big difference. Quality of equipment, again, rules and fouls, all these are extrinsic factors. Coming to rehabilitation aspect, we moved on from a price regime. Now we need peace and love. So initially, whenever an injury occurs in the acute phase, you have to protect that area and manage pain. And of course, diagnose the injury properly. Elevation has got an important role. A lot of recent literature evidence is suggesting that we should not take anti-inflammatory medication. Now, again, this is a bit inconclusive, but what a lot of people are saying that by getting anti-inflammatories, we are interfering with the natural healing process. Um, I would suggest that, of course, we don't prescribe medicines, but maybe it's an overuse injury, then the role of anti-inflammatories can be limited. But sometimes acute injuries where there is a lot of swelling at that joint, then maybe they might consult a doctor and take some medication. Compression plays an important role. Having compressive, using compressive bandages, elevating will reduce the swelling quickly, and educating your athlete, telling the athlete what exactly the injury is, what are the treatment options, if needed, any investigations, and all that. Then, as we move on, we want to get that person active really fast. A lot of evidence has come in that the earlier you mobilize the athlete, the faster will be the recovery. Create an environment of optimism for the athlete. If it's a younger athlete, many times I don't discuss everything with that athlete, very young athlete. I might involve the parent, the coach, and discuss with them because psychologically that can have a very big impact with a younger athlete. Uh, Try to include some amount of cardiovascular activity. If the person is injured, like if a person is injured the shoulder, the person can run, cycle, or if the person has just injured the ankle, then getting to do some cycling again might help, because that improves the circulation in the entire body and helps in clearing up all the debris, the reducing the inflammatory stage, and enhances the healing. And then have a proper exercise program quickly. So from a minimal activity phase, we want a full functional activity. And when we are treating an athlete, we just should not consider about the musculoskeletal system. It's the neuromusculoskeletal system. So don't forget that in the end, the brain and the nerves are controlling your active system. And then there is a static system involving and a stabilizing system of ligaments, joints, and bones. So here, what I mean by neural system is, if you found that due to wrong technique, due to wrong form, this injury has occurred due to wrong biomechanics, then starting to correct that at an early stage is really very important. That doesn't mean that athlete has to go on the field and start correcting that technique, but even explaining them through some videos, uh, going through their past videos, showing them some videos of good athletes who have better form. Even showing them these videos will start creating some amount of neural pathways and understanding, which once that athlete gets to the level of playing, that can be incorporated. So all these aspects, or devising some exercises where certain muscles, if they are not getting used, or certain muscles which are getting overused, uh, we can start training those without actually getting back to the sport. So the neuromuscular system is extremely important. And when you're treating the athlete, these are all the aspects of rehab which we talk about. Our so first aim is to get range of motion. So flexibility and range of motion. Once we start getting that, we slowly start working on strength, endurance, core stability, motor control, proprioception. All this comes in the neuromuscular training. And then proprioception, balance, coordination, agility, plyometrics. So all these things need to be incorporated in your exercise program. So make sure, so if it's an ankle injury, you're making sure that you've included early on proprioception, balance exercises, and slowly, once the person can able to run, then you have specific agility drills. Once that is achieved, then going on to plyometrics, and then the athlete is ready to return to playing. Return to playing is not return to competition. These are two different aspects, which we will discuss a bit later. So this is a simple chart. Don't go on the intensity. I've just highlighted. So whenever an athlete comes to you, uh, and whatever the injury is, we have to have these 5 aspects in our rehabilitation. So once the acute phase is gone, we move to a subacute phase, where we've achieved considerable range of motion. So for example, a strength training program, maybe we can't include that joint in strength training. So if an ankle or a knee injury or a shoulder injury, so for example of a shoulder injury, but we can early on start lower body strengthening. So don't miss out on that, because athletes love to exercise. And if you keep giving them certain things to do, they will be highly motivated in the rehab process. So make sure you're giving them some kind of exercise program. Even I start my athletes with after ACL injuries with the upper body program in 2 weeks. And once they go on to a hinge knee brace, I tell them to go into the gym and work out, because then they start, that whole psychological effect of this is very high. And that's a really important aspect of working with athletes. Make sure that you're including stretching protocols. This might be a time to also assess their, so if there's a lower body injury, you can assess their upper body flexibility, upper body strength, and start working on that as well, because this will give you some time. Proprioception, core stability, similarly, and moving on to functional drills. So have a plan ready this way, and every day you should address some aspect of their some aspect or in some type of exercise uh, during the week. Again, when managing these injuries, keep a very individualized approach. There are no protocols, according to me. Yes, there are guidelines, but each athlete is different. We have to consider age, gender, past similar injury, the sport they play, individual strength and weakness. Don't just simply follow protocols. Yes, protocols can be followed. Say, for the first 3-4 weeks after if the patient has undergone some kind of surgery. So yes, there are protocols for that. Every surgeon likes to follow a protocol for the first 3-4 weeks, but then your ability as a therapist to convince the doctor that this person can do a faster recovery, can move on to faster weight bearing, or can move on to faster range of motion. So you should have that level of communication with the doctor. And most of the doctors who refer patients to me usually leave it up to me. And if I somewhere feel that, this protocol has become very fast, the usual protocol, then I communicate to the doctor and tell the doctor that, this guy is not coping. And, after increasing the exercise, there's some swelling coming up or there's pain coming up. We need to slow down, or we need to see why this is happening, and accordingly alter the exercise program. Compliance. So when you give such a good program to your athlete, check on compliance. Usually athletes might overdo things. So it's the other way, where most of our patients don't do the exercises which we prescribe very regularly, because once pain goes, they don't want to continue doing it. But with athletes, it might be opposite. So make sure you do some kind of, ask the athlete to write a diary, send you photos, what they did in the day, and keep the rehab very exciting. Okay. add different kind of exercises where the athlete is completely involved and keep changing them. So I usually, if I'm not, usually I see any kind of patient on a weekly basis, tell them a certain set of exercises and try to, progress them depending on the recovery which I see, and keep adding more new and new exercises. So when the time comes to return to sport, okay, or sorry, return to playing. Let's keep it return to playing, because few things that when is the person ready to return to play? The person is ready to return to play after he's gone through all stages of rehab. You have done some functional tests like a hop test or a jump test or agility test, and then the person can return back to playing. There are a lot of criterias for every specific injury, like an ankle sprain, like an ACL, like a shoulder. Okay, so you have to go through. So if you are seeing in the case of shoulder, there's a shoulder throwing program. So before actually that person starts practicing with the other players, starts playing with the other players, make sure he's gone through all these stages and you've not missed out on anything. Okay. And again, there are a lot of other criterias. I'm not going to go into most of the details, but wherever possible, when the person starts return to play, um, that time use some protective equipment depending on the nature of injury if it's needed. Initial stages, uh, understand what the demands of the sport are. If it's a contact sport, I will always delay return to play and return to sport, competitive sport. Whereas if it's a sport like badminton, tennis, back of the mind, I will always try to push this person slightly faster. Again, it will be very individualized on the individual capability of that person. Okay. And again, if for some reason, this player has to get back to sport earlier because there is an important selection match which will determine the entire year for that player. There are these case scenarios where, actually the athlete is not very ready but has to play few matches to get selected in the team, in the selection process. So you have to explain the athlete what are the pros and cons of doing this. And sometimes you have to allow the athlete to participate in that selection trial or the or such kind of a event or game, and we have to discuss this properly with the coach and the family, or the if the athlete is less than 18 years, then keep the parents also involved. So return to sport always has to be very transitional from local, regional to global. First, the patient should play, if he's an international level player, then or a national level player, play in some city tournament or a district tournament, then go on to state, and then go on to playing at the national or the international level. What I see also, one more very important criteria is, can a athlete go through the entire training session without pain? So, for example, for tennis, if there are two sessions, morning, evening of 3 hours each for an international national level player, has he been able to complete those training sessions without pain? That is also a very important criteria for me. And once that is achieved, then I would ask him to compete at a lower level, in a district competition, and then go on progressing. So I think we've covered all these things, and all this, depending on the level of the athlete, a psychologist can play a very big role. So as a sports physiotherapist, always try to get in a sports psychologist in. If the athlete for some reason cannot access a sports psychologist, then you have to play that role and keep talking to the athlete and understand the psyche of the athlete. So if you don't go through all this process, of course, the athlete is prone to re-injury, will not be able to perform at the same level, and predisposed to injury to some another body part. So all these things we have to take in care and explain to the athlete and not be in a rush to return to sport. I have covered these points. So many times what happens is, say, for an ACL injury, the athlete is out for 6, 8 months. So at roughly 2 months, 2.5 months, I tell the athlete to go and sit on the bench where his team members are playing, if it's possible. Again, because a lot of times what happens, they lose touch, they lose connect with the other players, and that also plays a role, that also plays a psychological, gives a psychological impact on that athlete. So let them go, attend some training sessions or sit there, talk to their friends, so that their motivation level to get back to the sport also stays high. Coming to another important aspect, of course, I'm not a nutritionist and we are not nutritionists, but nutrition again plays an extremely important role in injury recovery. So there are supplements in the market, which and when to take is extremely important. So during the inflammatory phase, omega-3 fatty acids, magnesium, zinc have got really good evidence. See, there are a lot of supplements in the market. But what I have highlighted in this table is what has evidence. Okay. Then moving on to the proliferative phase, where new cells are coming in, the collagen is getting, the tissues are getting stronger, collagen supplements, vitamin C, whey protein. If the diet cannot complete the protein requirement of that athlete, then protein supplements. And during the remodeling phase, vitamin D, calcium, and continuing protein, all these will help. So, if possible, again, having a good nutritionist working along with you will aid the recovery. Along with this, hydration also is extremely important. I have usually seen after an injury, when the athletes are not playing, their hydration levels really go down because they are used to, when they play, used to drinking a lot of water. But when they are not playing, their hydration level significantly goes down. So, for washing out of toxins in the body and for better healing, proper hydration is necessary. So, make sure that when you start treating an athlete with an injury, tell them to keep optimum hydration levels. To sum it all up, regarding the rehabilitation, this is a very old picture, but it covers most of the things. It all depends on the knowledge, skill, and ability of the sports medicine team. As I told you, it's a team approach. Alone, you cannot treat this athlete. Okay. So, along with your nutrition, psychologist, strength and conditioning coach, gradually, you achieve each block and then return back to sport. Now, what I'm going to cover is some current trends. What is happening? What are the new things which are coming up? I will be a bit fast in these slides because every topic is very elaborate. But just to give you an idea, do we really have to follow which everybody is doing? I feel not. Many times I keep following certain old things which I'm doing because they work. So you have to take that call. Your rehabilitation doesn't need to be very fancy and something very flashy, or you've seen something on YouTube or Instagram and then you try to do that. Experience will teach you that certain things help, so continue doing them. There's no harm in that. With regards to recent advances, we have biomechanical analysis, 3D, 2D gate labs, wearable sensor technology. But recently, I just came across an app where, it's an AI app where you just record a video and upload, and the AI does the entire biomechanical analysis. Now, I've not tried this app a lot, but, this is again drastically changing everything. So then, do we really need all these expensive labs to be set up? Of course, I feel yes, they need to be set up at that elite level. But at a primary level, using apps and these tools might help you to understand the biomechanics a bit better. Augmented virtual reality can be again a very good tool where the athlete can practice certain sport specific movements without being on the ground and without hurting themselves. A lot of dynamometers are used, handheld, isokinetic, complex systems with isokinetic, isotonic, isometric. There's a lot of increasing evidence of isometric testing as well. And this can give you some measurable objective data, which you can keep checking in your clinic setting if the person is improving. And comparison to the other side is extremely important. So again, when you're returning to sport, you want nearly equal strength and range of motion to the other side. So for this, these tools can be handy for measurable objective outputs. BFR is another interesting thing and showing a lot of evidence. This can be used as a preventive or in training tool as well, and after injury as well, where we can give a lower intensity exercise using BFR to get the benefits of higher intensity exercise, especially in muscle hypertrophy. Electrostimulation, again, we have these wireless devices which can be nicely used while doing the rehab, and they can aid the strengthening aspect and enhance further recovery. There's a lot of use of sonography. Okay, I'm talking about diagnostic sonography. So again, a lot of injuries can be detected without MRIs, and having a good connect with a radiologist. So I have a few connects in Pune here. Wherever I, am struggling with a simple injury, a muscle strain, or anything like that, or a shoulder problem, and many times, and an MRI is really not needed in this case. I ask them to get a sonography done. So sonography can really help, and musculoskeletal radiology, sonography, ultrasonography is one thing which you should involve in your practice. Of course, we can't do it ourselves. There are a lot of therapists abroad who are using sonography, diagnostic sonography, for quick diagnosis of injuries, but due to rules and regulations regarding sonography machines, it's better you consult a radiologist, and a radiologist to really specialize in musculoskeletal radiology, sonography, because the reports can be really varying. A normal radiologist or sonologist might not be able to pick up musculoskeletal injuries unless they have good deep knowledge about it. Another thing is massage guns, MFR. We've all seen this. Good tools, and can be used to reduce for recovery. Balance systems for proprioception, again, good tool in that stage where the person cannot do these get on the field and do proprioception and balance exercises. And again, this keeps the rehabilitation very exciting, very objective. But again, we have to consider the price of these equipments, and we all at a small clinic level might not be able to afford to have all these systems. Agility tools, blaze pods, that's all there, which is used for training. There are these specialized timing gates for agility where you don't have to use a stopwatch. Once the person passes through that gate, it'll give that time. Multiple such kind of gates are used they are based on infrared technology. And coming to the physiotherapy aspect, we have shockwave, matrix, PMFR, RPW, cryo chambers also one thing. I did not really touch a lot on recovery because again that can be a very elaborate topic. But cryo chamber also, where these are chambers where up to -100 degrees, they take the body temperature down, and of course the exposure time is very less, and it becomes very easy. Of course, these machines are quite expensive, but setting up an ice bath, getting ice, and all these things both have slightly different effects on the body. But cryo chambers will be something which you will see coming up quite significantly. bracing, taping, have your good taping skills. There are really nice braces available. Sometimes the athlete, there are braces available which can be used by athletes who have ACL complete tears and then still can participate in the sport. Of course, long term, this can become a bit cumbersome, but use all these braces and have a good knowledge and awareness of all these things. Coming to a few other special considerations when you are treating athletes, children, women, and elderly. So when you're dealing with children with sports injuries, consider growth spurt. A lot of injuries are related to growth spurt. So having a good, stretching regime, especially what happens is when the growth spurt happens, the flexibility of muscles suddenly drops. And if an athlete is doing stretching in the age of 11 to 15 properly, then lifelong flexibility stays good. And if stretching is not emphasized in this part, then they will have tightness issues all their life. So, in the age of 11 to 15, 11 to 16, stretching is extremely important. Of course, there will be technique issues. Children learn a bit slower, the right form and technique. So keep a watch on that and work on that, because then again, that's going to help them for the rest of your life. Okay. Look at alignment issues, look at nutrition, look at foot alignment. And at kids, either they will not report or they will over report. So you have to understand that as well. What is the psychology of that child? In women, there are certain alignment issues. We all know that women have a higher Q angle, and that predisposes them to more injuries. There are hormonal factors, menstrual cycle, which needs to be considered. Uh, Strength training is not really emphasized, even in males. Okay. So actually, from the age of 11, strength training can be started, of course, under supervision, and it is not going to affect the height. This is a very big myth, but a proper strength training regime needs to be started, and that will prevent a lot of injuries. Older women can have bone density issues, so older athletes, they need to be screened for that. And of course, women are doing a lot of multitasking. I get a lot of recreational runners, women runners as patients, and I can see the stress apart from working, managing the family, and then they want to even be good at sport. So that can be quite a challenging thing for them. So sometimes I have to tell them to slow down a bit, either reduce their training loads or then reduce their work sometimes, because definitely they multitask much more than men. And usually, I feel that women tend to take more peer pressure than males, and they are more performance oriented than males. So that also has to be considered. Coming to elderly athletes, there are degenerative changes, there's osteoporosis, maybe sometimes obesity as well. They might have systemic illnesses like diabetes, hypertension. Still, they want to do their sport. There will be reduced balance coordination. So make sure you address all these aspects, and the flexibility also drops as the age grows. So even that needs to be taken into consideration. I think I have covered most of these topics in my talk today, but preventing injuries, one, two, three aspects I did not talk about. Proper warm up is necessary. We all know that we don't need to do a lot of stretching in the warm up. We need to do mobility drills. We have to take the joint, which is going to be mostly used through all the range of motion, but we really don't need to stretch before playing. So keep that in mind, because actually overstretching before playing might inhibit the muscles to perform better. So mobility drills, dynamic stretches are more important in warm up, and post game static stretching is really very important. The most important thing for preventing injuries, if you ask me, is static stretching post exercise. That would be really important according to me, which a lot of athletes don't end up doing. Apart from that, as a physiotherapist, we can do musculoskeletal screening of the athletes, where pre-season we screen the athlete for any biomechanical issues, posture alignment, static alignment, or a running assessment, and general mobility of the muscles, and then make an exercise program so that musculoskeletal issue doesn't translate into an injury later during the season. And screening can be done on a regular basis every 3 months, 6 months, to see whatever you advise has changed or not. So, what is the future? AI will play a very important role. AI will help us in periodization also. Now, periodization again is a very big topic. It considers volume, load, intensity, periodization, divides. So, every athlete needs to be periodized for 4 years. Generally, Olympic sports do periodization for 4 years, where their training program is divided into micro cycles, macro cycles, and slowly AI is going to play a big role in this, where AI will help us to calculate the training load. Okay. uh, Again, use of virtual reality will increase. Use of wearable devices which directly give information. So even before, like, a lot of top teams wear GPS devices on their body, like in football and all, where even before the athlete realizes that he's getting tired, the exercise physiologist sitting there at the bench realizes that this person has run too much in that half an hour, 45 minutes, maybe needs some break, and then they can do a substitution. Uh, Again, other treatment modalities such as PRP, plasma rich protein, stem cell therapies evolving, um, and gene therapy. So, there are a lot of these genetic tests which have come up which can cause early detection. But I think we are still very nascent, or this genetic analysis is not that advanced because there's so many genes. Okay, so analyzing all of them is still not possible. So finally, create an environment for optimal healing. As a sports physiotherapist, we want an accelerated rehab, but accelerated doesn't mean aggressive. And try to be as progressive as possible without breaking rule 2. Thank you.
So much, sir, for a delightful session. And, within just a few minutes, you have covered such important topics. And of course, the time is very less. We have so much to discuss and so many questions. So, without any further duos, if anybody has any questions, keep posting in the chats. And I can start with the questions that we already have got during the session. So there's a question that is put up. Hello, sir. Is open kinematic chain exercises allowed in ACL rehab by third week? Some surgeons emphasize on this early in rehab, but research doesn't support it. What is your opinion about it?
So open kinematic chain exercises, according to me, can be included in early rehab. But say, so what is an open kinematic chain? So like a leg extension exercise. So if I see that athlete has already developed a lot of hypertrophy in the quadricep muscle, then I will ask the athlete to do leg extension, but I will avoid the last 10 degrees of leg extension. Why? Because the last 10 degrees of leg extension puts a stress on the graft. So you'll have to modify. If I'm seeing that and if I've done a very good prehab, so many times see ACL is a elective surgery. It doesn't need to be done immediately. So if I have had an opportunity to see that athlete before surgery, I've made sure that we've done some muscle gains before surgery. So again, it will be patient to patient, person to person, if I'm seeing distinctive hypertrophy, then I might use something like a BFR or electrostimulation, and then make sure I avoid terminal extension. Okay, but flexion is okay. So doing a hamstring curl is fine, provided that by second week I have achieved at least 100 degrees of flexion. Then I might also start some resisted flexion up to 80 degrees. So don't make it painful. And yes, terminal extension as an exercise with resistance is not recommended. So last 10 degrees you can simply avoid to create pressure on the graft.
This brings me to the next question. As you said, if you get a chance of prehab, so there is a new, saying or a new pattern that has developed in the field of sports, that prehab is the new rehab. So, what role prehabilitation, in your opinion, plays, whether it is for injury prevention or for an elective surgery?
So, see, prehab uh, is used in a very lot of ways, I would say. So, everybody should be doing strength and conditioning to play a sport. Would we call it prehab? I would not call it prehab. I would call it a part of the training schedule. Okay. And for that, what I mentioned is we need a good strength and conditioning coach. So yes, to call it, you can call it prehab, where the strength and conditioning coach is taking good care of their athlete to prevent injuries. That is injury prevention, I would say. But if we specifically say prehab, I would call it, say, I know that athlete is going for an ACL surgery or going for a shoulder surgery, then, and I have at least 6 weeks. In 1 or 2 weeks, nothing is going to happen with regards to strength. But yes, range of motion is really very important. There are a lot of studies which say that if a person with an ACL injury has deficit in range of motion before surgery, getting the full range of motion after surgery is very difficult. So yes, that prehab would be more directed towards getting full range of motion. So again, as I said, that it is very important prehab, and if the person is not injured, then that would be more of strength conditioning, agility, proprioception, which should be there in every athlete depending on the nature of the sport.
Question from the participant. In case of multi-ligament injury in knee, some patients prefer to get rehab and then go for surgery. But won't it put more transitional motion where we don't have ligament to stabilize?
Uh, Multi-ligament. So if the MCL is completely torn, there is no question that person will have to go quickly in for surgery, because then I won't be able to make the patient stand also. If there is a grade 3 or a very severe meniscus injury, then also maybe the range is restricted due to that meniscus. Then also maybe I won't be able to force the range of motion. So again, it will come patient to patient, case to case. But I have patients who have had a grade 2 meniscus and a complete ACL tear, and we did good prehab before the surgery, and then they were questioning me, do I really need the surgery? I'm feeling much better. So again, it will be on the degree of injury. If you are dealing with an grade 3 MCL, no, that person will have to quickly go in for surgery. But if it's just a purely ACL, I have had patients running in a straight line in 2.5, 3 months after the injury without even doing the surgery. Yes, I tell them clearly no pivoting motion, no change of direction. They do heavy gym workouts, and we make sure it's all pain free. There is no pain. They do heavy squats. they do heavy deadlifts, and all these things.
So, a lot of times our body tells us something is wrong with us, right? It gives us warnings, it gives us signs. So, are there any lesser known early warning or signs of overuse injury which, often goes unnoticed in the body?
Uh, Few things when what many times I tell my athletes is, if a pain is there in one area consistently for 5 to 6 days and it is worsening or even staying the same and not going, then the first thing you need to do is take rest for 1 week. If you cannot consult anybody, say, uh, and then you slowly try that same activity again. And if the same intensity of pain is there, you go and see somebody. So that is what I usually tell, because I have, a lot of recreational people coming to me, and sometimes it really becomes difficult to deal with them because they've, you know, for them, this playing or running has much a psychological impact on them, if they are not being able to do that. So one thing is pain persisting in one area for more than 4 or 5 days. Any visible swelling, uh, any continuing pain. So many times with overuse injuries, they have pain during the activity, and then after that, during the day, they are fine. But if that pain is coming again during the day also, when they are really not exercising, they're simply walking or climbing upstairs, they need to consult somebody.
Uh, we are short of time, but there's one last question. Any books or any journals you would recommend for students who are pursuing sports physio to get more knowledge?
According to me, Karim Khan is the best if you're starting off with, because it's really a good book which can be followed. It's kind of a Bible for understanding sports injuries, not only as understanding rehabilitation, but again, understanding even the orthopedic and the surgical options for that injury. It has good assessments. And then there are many journals which are available, Josh PT and all things which they can update themselves with.
Thank you so much, sir. I know all the participants have so many questions, but we'll try to get their questions and we'll post it. And then, we could just post it online when we, put it across that, few questions were left unanswered. But thank you so much for your time and for your knowledge. I would now ask Dr. Siddhi to take over and give the vote of thanks.
Hello everyone. On behalf of Indian Association of Physiotherapy Women's Cell West Mumbai District, I, Dr. Siddhi Gotecha, Sub-Coordinator West Mumbai District, would like to propose the vote of thanks to all the dignitaries and the participants. First of all, a big thanks to Dr. Anand Gangwal, our resource person, for today's interactive session. We hope all the participants have gained great insights from the knowledge shared here. Thank you, sir. A special thanks to our President of IAP, Dr. Sanjeev Jasar, Dr. Ruchi Ma'am, our National Head of IAP Women's Cell, Dr. Pooja Kamble, our Zonal Head. We are really grateful to the IAP Women's Cell Maharashtra State team, Dr. Suvarna Ganvi Ma'am, the Maharashtra State Coordinator, for mentoring us in the best ways possible. And all our state sub-coordinators, including Dr. Snehal Patel Ma'am, Dr. Uttara Mohan Ma'am, Dr. Priya Karande Ma'am, and Dr. Nirali Sangvi Ma'am for supporting us with this webinar. I would also like to thank all the participants for their overwhelming response for this webinar. And last but not the least, I would like to thank our digital team of IAP Women's Cell. Special thanks to Dr. Nagraj. Last but not the least, I would like to extend my heartfelt thanks to my team, Dr. Urvi Katakia ma'am, West Mumbai District Coordinator, Dr. Neha Mishra, and Dr. Varsha Chandra to make this event successful. Thank you all once again.
Thank you. Thank you for having me here.
Thank you, sir.
Thank you, sir, so much.
Before we leave, if you could stop sharing your screen and we could take a screenshot with all the participants, would be great.
I'll just switch on my video. Yeah.
I request the attendees, if you could just turn on your this, so we could just take a picture.
Finally, how many participants attended?
Some more than 56.
Nice.
Thank you so much, sir.
Thank you. Thank you. Thank you.
Thank